Hey everybody, we are really excited to have you here today for the last day of the 5th Annual Parent Network Workshop. We are pleased to have you join us for not just a convenience or a crutch, including mental health accommodations while developing IEPs and 504 plans. Before we get started, there are a few housekeeping items. If you have questions during the session, go ahead and use the Q&A feature that is part of Zoom. It just helps us keep track of comments a little better. We're going to have a poll that pops up at the beginning just so we know who we're speaking to. It's anonymous, so please feel free to click on that link. Also, after the session, you'll see a survey pop up about how you feel about this session. If you can just take a minute to give us feedback, that helps us develop new workshops for the future. We really appreciate it. And if you are an Idaho parent, the Idaho Parent Network survey for 2020 just went live this week. And there will be a link that is emailed out to you tomorrow. But also, if you would like to take that survey, you can find it at idahoparentnetwork.org. This year, we're asking questions about the topics that we talked about in our workshop. And we're really excited to see how families around Idaho feel. And in the coming days, we will be posting the slideshow from today, a video of our presentation and the resources we discuss. So make sure you check back at idahoparentnetwork.org for those resources. So with that out of the way, we're going to go ahead and have not just a convenience or a crutch. And I'm going to introduce our speakers. So we have, let's see, oh, my speakers have decided that my slides aren't changing. Hold on, there we go. All right. We have with us Dr. Charlie Silva from the State Department of Education. She is the Special Education Director. And we have Angela Lindig, the Executive Director for Idaho Parents Unlimited. You guys might know that as IPOL. Renee Miner, everyone knows it as SESTA, but it's really the Special Education Support and Technical Assistance, and she's the Associate Director at Boise State. And then I will be joining us for the entire session, not just popping in today, and I am the co-director of the Idaho Parent Network for Children's Mental Health. So our objectives today are to understand the intent of an accommodation, to learn how to tell if an accommodation is appropriate, to identify ways to know when an accommodation needs to be changed, and to learn how to embed a plan to fade some accommodations away during the planning phase. So that's what we're going to kind of talk about today. And I wanted to start with, why are we talking about this? So I know as a parent that I have found myself in meetings, both 504 and IEP meetings, and somebody will cleverly say, well, what kind of accommodations do you want? As if parents have an accommodation fairy that runs around and tells us the perfect thing that is going to happen. I don't happen to be a school teacher. I have no training to be in public education. And so when you ask me that question in such a wide range, it's hard for me to answer. I don't know what to say. So I'm very overwhelmed. What's possible? Like, is there a menu, or is there something you want me to say? What makes sense? What are we trying to do? How do I know if it's going to help? All of these things are difficult for families. So we're going to start with a little background, and then we're going to work through it. So Renee, what do you think? You are on mute, friend.
That's just great. Okay. So what is an accommodation? So we're talking about changes in the curriculum or instruction or the testing format or procedures that allow your child to be able to participate in a way that gives them access to their instruction and doesn't diminish it. And we want them to be focused. We want all of this to be focused on their abilities, what they can do, what are their strengths, rather than focusing on their disabilities. Right. Accommodations are generally considered to include assistive technology, and it can be changes in how you present the information to the child. That would be relative to visual or auditory difficulties. Responses, how the child responds back to the teacher or to the instructor, or timing. If the child becomes anxious with limits in timing, or maybe they need extended time to complete tasks, that would be a relative to that. And scheduling, what benefits their best learning experience, what kinds of amounts of information are given to them at a certain time, and then settings, and that would include settings that were low distraction, or perhaps there were some environmental adjustments to those settings. The important thing to remember, though, is that we're not fundamentally changing the learning or the expectations for learning for the child. So accommodations should not invalidate any assessments that are going on, any testing results, and they should not fundamentally alter the requirements or the learning experience, the expectations or the curriculum.
I think that's an important one because I think accommodations may very frequently be given as the catch-all for changes we make. I think that sometimes the word accommodation for parents is, how are we going to change things for the kid? And the fact that that may not be an accommodation, that might be, you know, something else, but it's not an accommodation. I think that's important for families to know.
It gets confused frequently with modification. And so, and that is where you're potentially modifying curriculum that alters the requirements.
Right, definitely. I know that parents consider reduced homework or no homework to be an accommodation, where I think it might actually be more of a modification.
Correct. And the focus then is really helping that child have those learning experiences at the same level or the same quality as their peers, but there might be some differences in how this learner needs to access that information.
Great. Well, Renee, I want to chime in if that's all right. And I'm going to ask Angela as well, as we talk about questions to ask. And before we really talk about questions to ask, I wanted to remind everybody, when you go into the IEP meeting, when you go into the 504 meeting, go into it with the mindset that you are there to advocate and participate in creating a plan that is designed for your child. Not all children, but your child. And the reason I'm really emphasizing this is because Laura said something early on about, well, I don't know what to ask. And oftentimes educators are like, well, I'm a little unclear on an accommodation as well. And what has happened and continues to happen even today is some teams, some districts, not just in Idaho, across the country, will have a menu of accommodations. And those menus are typically developed around what Renee talked about. You know, how can I change the presentation, the response, the timing, the scheduling, and you'll even see them organized that way. Well, here's a whole bunch of accommodations for scheduling modifications or setting modifications. And what happens is that when you have a menu in front of us, I don't know about you all, but it's like, ooh, that sounds good. Oh, I like that one. Wow, I hadn't thought about that. Let's check that box. And then what happens is you have set something up that may or may not meet the needs of that individual child, because that's who you're there for. What is it that my child needs to have accommodated so that they can, again, here's the operative word, have access to their education.
Charlie, I always think of that as the genie from Aladdin. Try some of column A, try all of column B.
Exactly.
I'm in the mood to help you, dude. Yeah, that's how I consider those kinds of meetings when they go.
Yeah, well, and then what happens is it's a setup for everybody, right? Because that's the foundation, and the foundation is not solid, right? So you're starting with a wobbly foundation, and with a wobbly foundation from there, things aren't going to go as planned for a couple of reasons. One, they may not be individualized for your particular child. And secondly, and I think this is sometimes we overlook this, they're not reasonable. there's only so many hours in the day, guys. You can only do so much in the 6.5 hours in the day. So really it's about, in my mind, thinking about not only what is the purpose, but how can I achieve it? And how can a team realistically achieve anything if we're continuing just to have this ginormous list of accommodations that may or may not be appropriate. Angela, you want to chime in on anything? I kind of went off.
Yeah. I think it's really just important for people to understand, what are we accommodating? What is, what are we accommodating? Rather than looking at a big list of types of accommodations, what exactly are we accommodating for this child? And then how is that done? Mm-hmm. And so I know we have some examples that you actually mentioned, I think a little earlier, but some of those are, maybe it's we're focusing on some self-regulation, and so how do we accommodate that child in regulating themselves and then to be able to access their education? So now you're going to look at what accommodations might work there. And again, it is extremely individualized. This is not something that is a catch-all. Go ahead.
Right. And you brought up something really important with that example, Angela, and that is, you start with, well, what is the need? And I'm jumping ahead and I won't steal your thunder or whoever's covering it, but I guess I am. But really starting from, there you go, thank you. Starting from the need, and this sometimes is when schools really need to hear from the family. Because let's say you have a child who is really struggling with anxiety. Who really is going to know the impact of that anxiety the best, oftentimes, is the parents and the family. The district can help you identify how we can come up with a reasonable accommodation, to minimize that anxiety. But sometimes schools don't know the magnitude of that impact, and that's where they need to hear from parents. But going back to what we're really supposed to be talking about in the script is having the conversation, but about, really when the team is at the table and when they are having the conversation about, an accommodation, you really do need to focus in on the need versus the want. And the example that I gave with the menu is the want, right? I want everything on the menu because it all looks good. But is that really what they need? And that you have to have that conversation. When I was the SPED director for the Boise School District, and this was years ago, and Laura's going to talk about it a little later as well, but I would have parents call and say, I want a one-on-one for my child. And you go, okay, well, let's talk about that. Tell me what it is that you think that that will achieve, or how that will assist your child. Well, I don't know. I just know that Sally, my neighbor, said her daughter has a one-on-one. And I'm like, okay, well, let's start there. It's, you hear about it, or you hear even, Facebook, Angela, you probably hear it all the time at IPUL. Well, they need a one-on-one aid, well, is it a need or is it a want?
That's a big balance. And we actually do talk, we do talk to parents about this quite a bit, and we'll ask them, if you are coming in and you're saying my child needs this, do you have some sort of evidence as to how that is truly going to be the way for them to be, for them to access their education? How is this really the best, going back to that least restrictive environment as well? And I think that's going to come up. So same thing, I'm not going to say too much on that right now, but definitely parents will come in with not even just I want this, but my child needs this. And so the question always is going back to the data. What's your evidence that they need this? Why do you feel that this is the most appropriate need for them?
I'd like to chime in here, because when it comes to mental health, if I got paid by the number of times I heard someone say, oh, but he's so smart. what? I mean, like, I have not actually seen IQ be a reason not to need an accommodation of some variety. Because if your child has, for example, crippling anxiety, they could be Einstein. And if they can't climb out from under the table because they're crying, they're not accessing their education. And so I think sometimes parents have to have really specific conversations about what that need looks like. You know, this kiddo might be absolutely functional and doing great, you know, for 5 of the first 6 months of the year. And then this or that may happen, and this kiddo's not gonna, you know, come out of the bathroom crying. You know, it's just, and so we need to make sure it is a need, that the kid is, you know, feeling safe, has someone to talk to, knows what their plan is. I mean, if a kid has to get up and walk out of a classroom because they are trying to manage their mental health safely, let them go, right? If that's the need. But sometimes people look at that and go, well, you know, if they were trying a little harder, they'd be fine. And I think because it's mental health is many shades of something, it's harder to say today they can walk, tomorrow they can't walk. Today they're verbal, tomorrow they're not verbal. You know, it's not that cut and dried. And today my kid is doing okay before lunch, and by after lunch we're not. And so that is, I think, something that needs to be specified by parents.
Yeah, and this is when parents and schools, so it's not just parents, it's everybody that's at the table, needs to take a step back, right? They need to take a step back when it gets to that of, you know, oh, they're brilliant, I don't understand, you know, or this, that, or the other thing. You need to stop and take a breath and go, how is it that we ended up at this table? How is it that we ended up here? Oh, right. The child was determined to have a disability in, you know, emotional behavioral disorders. That's your starting point, because when you determine that, you're asking, do they have a disability? How does it impact? And is there a need for special education? They weren't being evaluated for the gifted program to see if they qualify for the highly gifted program. They were being evaluated because somebody saw some, for the purpose of this conversation, some mental health or social emotional needs. So you stop the conversation and you go back to the beginning. Why are we all here? Well, we're here for Johnny. Well, what is it about Johnny that brought us to the table? His mental health needs. So now let's frame the conversation about how do we give him access to education given all of the challenges and struggles. But I really want to empower parents and educators. It's okay to say, okay, time out. Why are we here? And then start that conversation.
And
Well,
Charlie, sorry.
Go ahead, Renee.
Also, when I work with school teams, sometimes we use the language of barriers. What are the barriers for them being able to access their education or this curriculum or this environment? And when we think about it that way, it's a little bit easier to kind of think this very specific bridge is going to allow us to get there. The other thing is that it can change, like Laura, you talked about, from day to day or from environment to environment, from classroom to classroom. There's a lot of conditions, and so one accommodation is not necessarily going to fit in every classroom or environment that they go to. So thinking specifically about what their needs are across environments and days and conditions. And I love, Charlie, that you said go back and revisit it, because it's going to change, and you have to be willing to have those conversations.
So now we're going to talk about some common questions that we get from families, and we are already starting to get comments in the question and answer session. So we are going to try and fit as many of these questions in as we can as we move along. But one parent just pointed out that educators are not mental health professionals and need to be mindful of that. Mm-hmm. But on the flip side, counselors are not usually educators either. So finding a fit and a clear understanding of need is really imperative. If you're lucky, you have a super great school counselor that understands both.
And I take it a step further, and some are, not all. Parents aren't necessarily educators. Parents aren't necessarily counselors. Parents are there to advocate for their child, and they're very valuable. And that's why IDEA has such a strong, the Individuals with Disabilities Education Act, emphasis on a team, because everybody comes to the table with a different set of skills and expertise. So just always remember that.
So the first one we want to talk about is, how do we add appropriate accommodations, and can you have too many? Yes, I'm just gonna say yes, you can have too many. I mean, from the child's perspective and from the educator's perspective, because if they spend all day trying to figure out which accommodation they have to apply at any given moment, what else is happening? But if my kid has no idea what's happening, because today it might be like this, but then we changed it to be like this, but only on the second Tuesday, not ending in a Y, for which 3 people are sitting at the same table who don't, you know, don't eat peanut butter. I mean, like, at some point, it's too complicated. So what do you guys think?
Yeah, I would add to that too, Laura, especially if you have a child on a 504 plan, and it can get even more complicated as that child becomes in middle school or high school, when you have multiple teachers, multiple classes, multiple environments, and you're trying to address certain accommodations that maybe are not on an IEP. It can get very challenging. So it's really important that everybody, whether it be a IEP team or a 504 team, really be on the same page for what is necessary to be here, and when and where and why. And that way everybody's on the same team, so that if something's not being accommodated that should be, you can go back to that. But yes, I agree that you can definitely have too many. You can have too many too for the sake of that child and their buy-in. You know, are they needing all of those accommodations? And I think we're going to talk about that in a bit.
And I think it's important that we also, there's paperwork that goes with all of this. There's an IEP, there's a 504 plan, there's like actual papers that things are written down on. And I have always asked that the accommodations list be given to all staff that work with my kids. So they may not have every piece of the IEP, they may not have all the determinations and the evaluations, but the accommodation list, I want everyone to have. And that way, if we have a problem, there's a more likelihood that everyone's going to know what it is. But if it takes them a week to read the list, you know, it sounds like a comedy skit. You know, if your IEP is so long that it takes a week to read it, you might have too many accommodations. But maybe not. It's all very individual for your kid.
Well, and the other thing, and maybe Renee's probably gonna just wanted to share this, I'm sure, but the other thing is we want to be able to determine if it's effective. And how can you determine if it's effective if you have so many that you can't even keep track of what they're doing, to your point? So, you know, you have to look at it also from, you know, is it working, so that you can have the conversation later on about, oh, well, they didn't really need it. They used it once. Well, okay, there's some evidence and data that we can use to make an informed decision moving forward. So you always have to weigh that in as well.
Another thing to consider is the environment that it's going to be in. Teachers are great resources about what works in their classroom and what doesn't work, what kids access. And I think we're going to talk about it a little bit later, but also just not stigmatizing that child with an accommodation that overtly makes them stand out. So teachers can add to that information as well. What do I already use in the classroom, and how can I maybe intensify that or adjust it a little bit so that it fits in the environments we're asking the child to be successful in?
We just got a comment that made me giggle, that we should have 3 columns: want, need, and want to need. So this is our next question. How do we keep up with the accommodations of a student with mental health concerns? Their needs change so often. I actually had an administrator one time call me when my child was quite young, and he very excitedly told me that he was scheduling a meeting to discontinue all of my son's accommodations because it had been 3 days and he didn't need any help. And I remember, you know, being on the phone as I'm listening to this, and admittedly I was a young mom, and And this is an authority figure. And this was, I think, the first time I was consciously aware of wanting to mock someone in authority. Because, wow, you can cure mental health in 3 days? Wow, every kid on the planet is moving into our school district. This is going to be amazing for property values. I mean, what? I was just, oh, but it is hard because they always say you have to plan for what's happening now, not what we think might happen in the future. But with mental health, very frequently it's cyclical, or there are triggers that aren't aren't happening every day. So how do we handle that?
My initial reaction to this, twofold. One, keeping in mind, again, and I'll be a broken record for the hour, but it's about the individual child's needs. And then I think it's about prioritizing, right? And what's the data or the evidence you have that's most compelling to have the team address? So it's, again, going back to manageable and measurable, but manageable, so that you're not just so overwhelmed. And you're absolutely right. With mental health, things could change because maybe there's a med change, right? And everything then looks very different. Maybe it's they didn't get enough sleep, and they're coming through the school doors not quite in the best space. So you're right that it is constantly changing. That's why you really, as best you can. I mean, if we had all the answers here, none of us would be on this webinar, because we will have solved all the world's problems and be retired.
Well, Charlie, when my kid was younger, and even when he was getting older, we had a messaging system set up with his teachers because mornings were tough. And we could really tell how the school day was going to go based on how he transitioned from being asleep to being a functional human, before school. And we just kind of had a joke where I would send a message and all it would say was coming in hot. And then the teacher knew to meet the bus, or to have the aide there, or to have some soothing time when he first walked in, to tell him something positive about himself. Or, I mean, she had an entire bag of tricks. And over the years, when new staff members, be they teachers or, aides or administrators, heard about our coming in hot code, they thought it was hilarious. But it was actually kind of empowering to me as a mom to know that I could turn it over and that they knew what they were getting, like they knew what that meant. And we kind of built that into our process. Angela's kind of smirking, but I wonder how many parents are going to start sending coming in hot messages to the school now.
No, but the difference is, though, Laura, you did it in a collaborative team approach. You worked together to say, if this is the way it looks, here's what we're going to do today, and here's how we're going to address it. And everybody knew that it wasn't coming in hot. I'm coming in with flames shooting off the top of my head. Here's the kid. You all deal with this. It was very much an understood approach of how to address him on those days.
Yeah, oh, go ahead, Renee.
That is so important. We used to call those bad day plans, and I think that's a really important part, is that you have a plan. Just like in a fire drill, we've already got it figured out, right? Well, how we're going to walk and where we're going to go. And it's the same thing with these kids, is how do we set up the environment so it's ready for any kid that walks, any version of that child that walks through the door. And we've got a plan set up ahead of time.
But, Laura, one thing I just want to add, because you've illustrated it so well from a parent perspective, even with your example of the principal that, cured him in 3 days, but you got to love that one. But what it's all about, from what I'm hearing from you, is about communication. Whether it's communication that he cured him in 3 days or not, it was still communication. And that is, I think it's important in everything we do, but especially when you have kids who, again, the morning could look one way and the afternoon totally different, then that need for good communication with all players is just paramount. Can't emphasize that enough. And so, yeah.
And when, you know, and we actually, there were times that we would learn things while in treatment or in therapy that worked particularly well. Sometimes during hospitalizations that worked really well. And I would share with the school the phrases that my kid responded to. Like, we don't use timeout, you know, we use sit out. Because you're going to sit and you're going to calm down. And when you're ready, you can totally rejoin us. But timeout had a stigma attached to it. Having a sit out was just like, you know what, I'm going to take a chill. I'm going to be here for a moment and I'll come back. And he responded to that. So, you know, it was a communication plan, definitely. But our next question, how do we add accommodations without embarrassing the student? And I think as our kids get older, this becomes so much more of a thing. My kids started refusing accommodations that were exceptionally helpful because he noticed that the other kids were not doing the same thing. And so Renee graciously sent us this this graphic, and I kind of made it into two graphics. So we've probably all seen some version of the equity versus equality. So the first one, obviously, everyone has the same box, and the poor kid on the right still can't see over, but you know, everyone else is woohoo. Then the second one, we rearrange the boxes so that only the people who need to see over the fence are given the height that they need, you know, they need help seeing over the fence. But I think that we focus a lot on this. And my son was really objecting to having two boxes to see over the fence. Everyone can see those boxes, and he was not thrilled. So then I think Renee, I was really grateful you sent me this, because I was like, we need to make this wall art in my house. And that is this. So now we just make the fence see-through, and now no one needs a box. And that accessibility is really what, you know, sometimes our conversations in these IEP and 504 meetings is, why are we doing a thing at all that everyone can't participate in? I mean, is there a reason this thing has to happen in such a way that my kid needs to be accommodated? And simple examples that are outside of the classroom is, for example, when the parent-teacher organization has a big, you know, hoopla in the cafeteria and everyone gets together and it's too loud and it's overwhelming, or they pass out a sugary treat, you know, as for some school achievement. And, you know, could we just maybe not have a really loud event, or maybe have an event outside so the sound isn't so contained? Or could we not have sugary options passed out to a kiddo that's going to trigger them and they don't get one when everyone else does? Sometimes it just means making it, you know, friendly for everyone. Not everything can be made perfect for everyone.
Yeah, that's great, Laura. And we've got teachers now that are putting baskets together in their classroom that have varieties of seating arrangements, or wiggle seats, or fidgets, field ground overlays on their papers are available to everyone. And so just kind of removing those barriers, that this is for the kids that have differences. And it's kind of like, also, I think another part of this that's really important is teaching the rest of the kids in the classroom that every child needs to advocate for their own needs, and number two is we have to respect the differences of the other kids that are in our classroom, because everybody has unique presentations and we need to honor that and respect it. That needs to be our culture.
And the other thing I would just add, sorry, Angela, I'll make it real quick, is let's not forget about hearing from the individual, the child, the student. And sometimes oftentimes over my career, you know, parents will say, oh, no, they don't understand. No, they don't need to come to an IEP meeting. And it's like, yeah. And it's like, well, they're not old enough. Oh, yeah, they are. We just as a team need to change how maybe we present information, have them come in for part of a meeting, and maybe it is overwhelming or embarrassing. Okay, I get that. Then maybe who's the trusted adult at the school that the student feels comfortable with, and meeting one-on-one and saying, okay, you know, I'm getting ready to go into this meeting, and they're going to ask, you know, what is it that you need? What is it that we can do? But hear it when you can. Hear it from the child. That's why what this is all about. I just am a firm believer in empowering students at a very young age to start advocating for themselves.
So
And
Charlie, a funny story to that is that my son would send us a list of his wants and needs. And
Mhm.
he, when he was very young, he actually, I got a call from an administrator who, you know, when you see the school's phone number pop up in the middle of the school day, you go, oh, you know, why? And I pick up the phone kind of with the, yeah, you know, and she's laughing. She's just laughing. And I'm like, okay, well, this is promising, but also concerning. Why are we laughing so hard? And she said, guess who was in my office? Ooh, another, ooh, what? And she said, no, he was in second grade and he just, I guess, asked the teacher to go down to the office, and she let him, and he walked right into the principal's office. And she said, I look up and he's standing in my doorway and he says, you guys have a plan for me, right? And she, yes. It's like, it's not working. You guys get together and talk about this plan, don't you? Yes. You should do that. It needs to be fixed. Fix my plan. And he turned around and walked out the door. And so she was laughing. She said in all of her years in education, she had never had a student call an IEP meeting, and definitely not a second grader. And so he handed me a list of things that weren't working, you know, verbally, said, write this down, and told me what needed. And then, do you want to come to the meeting? Nope. You fix it and you let me know. And so as he got older, he would go to the meetings, but sit in another room with a book. So if we had questions, he could, you know, we could ask him. And one of our administrators popped out to go talk to him during this IEP meeting. And when the meeting was over and we were leaving and we were walking back through the parking lot, administrator happened to be walking along, and my kid looked me in the eye and said, Mom, he's pretty cool. Can we take him home with us? And so my son tried to pick up an administrator like a stray puppy and bring him home, because he felt that this person really got him for the first time. And after that, we saw his participation change a little bit and how he wanted to be heard. But yeah, so my kid loved to advocate, but most kids don't, you know, necessarily want to show up to meetings. And my kid did point out that adults are really boring when they get together and talk.
Laura, I want to talk about something just on the complete opposite of that, because I think it does need to be said.
Sure.
So we, and I'm allowed to tell my daughter's story. She gives me permission. I'm not going to go too deep into it, but my youngest had a 504 plan, and she had accommodations. She had a real problem with theft, and that was an ongoing concern, usually around food, but a theft is a theft. And we insisted that she be a part of her 504 meetings, because in our house, it is a nothing about us without us philosophy, and we don't talk about her without her. We also needed to make sure that she also understood that the things that we were grappling with at home were not just me and mom rules, that these are society rules. This became very uncomfortable for her team, the education team, to have these conversations about these really tough issues in front of her. And so there, you have to have that, going back to that communication, really having good communication with that team to explain to them that this is our house philosophy, and I know it's uncomfortable, but we have to be able to communicate with her and with you all so that we are on the same page and so that she can make progress. And anyway, that is something that I just wanted to bring up, because I know that's very real for many families, that it's not, you know, some of the issues that our kids have related to their mental health diagnoses are not pleasant. And so anyway, just wanted to throw that in there too.
Well, and I think that leads right into the next question, Angela. How do we get buy-in from the student on the accommodation? And, you know, my son was very adamant that he didn't want an aide, right? But could he actually stay in the classroom if he didn't have someone helping him do that? And so that was a skill. I mean, there was a whole plan to get rid of the aide who we adored personally, but needed to go, right? And what did that look like? The district would tell you it took a team of 20 people to be aware of him and to helping build the skills to get him to be on his own. But we did. it was an amazing sight to behold. It wasn't quick. It took a lot of interventions on a lot of people's side, and it was a collaboration. But I think having them, I like what you said, Angela, nothing about us without us. And that for us, that's how that worked. You know,
Laura, that takes a lot of courage to make a commitment for the independence of your child, but that's so important. As we think about putting any accommodation in, we want to be thinking about what's the long-term use of it. Some of the things that we put in as accommodations, like I still take notes, I still have a planner, some of those things are not going to go away, right? But some of them are things that as an adult, they're going to be barriers for other opportunities. And so be thoughtful as you make a choice about what your accommodations are. Include your child in those decisions. What do they feel like is working, and have them be part of that conversation. That's so important.
and I think that sometimes we can modify how, you know, how the adults feel the accommodation needs to happen versus how the kiddos think that, you know, this accommodation should happen. If you've got a kid who's dealing with anxiety, I have never met a kid who has anxiety who wants to raise their hand and say, I'm having a panic attack. Can everyone handle that for me right now? No. But, you know, does that person calm down when they're around people or by themselves? Does that person have a safe space that makes them feel comfortable? What does it take to get there? I mean, you know, if you have all the teachers knowing that this child asks for a bathroom pass and doesn't come back in 5 minutes, we know what's actually going on. They have excused themselves, you know, to go to their calm down area or to someplace safe. That's an accommodation that might work for an older child who's like, you know, I don't want to announce to the whole class that I am shaking and that I, you know, so I think it's finding the way that it feels comfortable. And that everyone's just on the same page. And when the teachers are like, oh, that's what's happening, it stops being a discipline issue. Like, this kid didn't come back from the bathroom. Yes, because this kid had gone to the, you know, pre-identified location to, you know, calm down. So I think that that was important in our family, is finding out what it looked like. So this is a big one, Charlie. I know you're going to love this question. Is an aid an accommodation? Oh, you're muted.
This is where I step out of my room and I defer to my colleagues. Is it an accommodation? Shall we take a poll? No, in all seriousness, to the definition of what an accommodation is, no, a human being is not an accommodation. It goes back to what we've talked about all along. Now, may a child have a one-on-one? Well, of course they can, but you really need to look at it from the sense of, you know, again, access to education. Number two, the least restrictive environment, and what are the needs. But I want to talk about this a little bit. And Angela, Renee, I don't know if you, maybe Angela, but Karen Gillette, who is a teacher here in the Valley, years ago, probably, oh gosh, probably at least 15 years or so ago, she really worked with her students on advocating for themselves, and created this pretty cool project where she brought students together, and these were 18 to 21-year-old students. Similar kind of what you did, Laura, with the Yes work when you brought some students to a work group, but really hearing from the students themselves who had gone through the educational system, and had them talking to educators about, well, this is what worked for me and this is what didn't work for me. Well, it was so fascinating, and I remember I was teaching at BSU at the time, and I had these students come to one of my classes, and this was just a group of students, so we can't generalize across, but the number one thing that they talked about that they hated was having a one-on-one aid. And here's why from their perspective. It was stigmatizing. They felt like they answered for them. Many cases they did the work. maybe, yep, it's, you know, and it goes on. And it really, a light bulb went off for me in terms of, wow, you know, that was really powerful. And we think about it, and especially from a parent perspective, don't we all want everything, and we want the best for our students? And again, going back to that menu of, well, gosh, one-on-one all day as a full-time accommodation, wouldn't that be awesome? And it's like, maybe not. But no, an aid is not an accommodation. And here's the thing, and I'll get off my soapbox about aids, because I do have lots of concerns. I do feel that if it's not done appropriately, or used appropriately, it can become a crutch, and it can become very stigmatizing. And here's why. Because oftentimes people just say, okay, fine, we're just going to have an aid. Okay, but for what purpose? What need are they meeting for that child? How do we know if they've achieved it? What is the plan to scale back or withdraw the aid, right? We don't have those conversations like, oh yeah, you have your one-on-one aid and they're just going to go with you. And it's like, no. We need to be more systematic in that approach and clearly identify what is it that they're assisting to allow access to education. How do we know if it's working? When will we determine to pull back that accommodation? So sorry, I went off, Laura.
Well, that's actually, and Angela, you can speak to that, but it's answering part of our next question, which is how do you know when an accommodation isn't working? But that means you need to know how it would be working. Like, right. You have to know both sides.
Mm-hmm. Well, and I think there is a difference. I think it needs to be stated, you know, there's a difference between perhaps a related service person, such as a behavioral interventionist, who may be assisting your child throughout the day or different parts of the day, versus just a one-to-one aid. Yeah. And so, you know, I do know that there are kids, going back, not mental health, kids who have very significant developmental disabilities who may need that full assist throughout the day, and then to be able to access the general education classroom with their peers. They could not do that without that, and there may not be that same level of stigmatism happening there, but stigma. Stigmatism is your eyes, never mind. Anyway, so but yes, but again, goes back to the individual child, and then what is that service that's being provided? And no, it's not an accommodation.
And you know, and Renee can address this, and even with those in that situation, Angela, and I'm glad you brought it up, maybe it is a behavior interventionist or somebody similar to that, or maybe it's a student with significant needs, maybe medical health, etc., where you would need to have more assistance. I still say, and we don't do a good, we have opportunities to do a better job of keeping track of what is it they're doing and is it working, because otherwise it becomes, there's the potential for it just to become second nature, and it's always there. And are you creating independence or codependence? And that's just always a real concern for me for the individual child. Help or hindrance? And Renee, I don't know if you want to add anything from a behavioral perspective.
Yeah, absolutely. I think we need to do a better job of defining what the role of that individual is in that educational opportunity, and remember that we want our kids to be able to access independent strategies. So there's a lot of tools that we're coming to understand that can help the child reduce anxiety. The adult might help teach that individual how to better identify what their body's doing, how it's feeling, and what they should do when it feels like that. But once that child becomes fluent in that skill, then absolutely we want to be looking at how can we fade that adult's interaction with the child at that point.
So that kind of feeds in exactly to the next question. How do we transition away from accommodations to help the student grow without setting them up for failure? And we've had actually a couple of comments come in while we're talking. One of them is, very often we have kiddos who their brand of anxiety makes them look like perfectionists at school. And then they get home and they fall apart, and not just a little bit, you know, like just absolutely fall apart. And when the parents come, and I think very frequently they say, you know, we need to do this, and they hear, well, that we're not having a problem at school. Well, but the minute they walk in the door, they're putting a hole in the wall, or, you know, they're hurting themselves, or, you know, sometimes we're seeing eating disorders, or, you know, we're seeing these things that they look great at school, but this anxiety is building and building and building and building. And we have a problem that needs to be managed at school because it's impacting their entire life. And I know that that's a little bit harder sometimes for teams to wrap their head around, that, you know, this kid is holding it together, so they're fine, right? Well, no, they're not fine. they're duct taped together, and the seams are splitting when they walk out the door, and that eventually is going to impact everything. So not waiting for it to impact more. And that's I know one that parents struggle with a lot. And then it kind of tips into school refusal. Very frequently we end up with that anxiety and that stuff tipping into school refusal. And then the problem we have is that the team comes back, says, well, if they're not at school, we can't accommodate them. And then the parents go find a wall and start banging their heads against it, because now they feel like they're chasing their tails. So actually I put two questions in together because I think they kind of go together. If we don't manage it, there's unintended consequences that then trigger things that are a bigger problem than we didn't manage at the beginning. So how do we do that? Because that feeds into how do we set it up, because we don't want to pull supports away before they're ready, because we didn't have a transition to success plan.
You know, a couple of thoughts with that. Well, first of all, I've sat in those meetings over the course of my career, a few, if not more than that, you know, where the parent does come in and say, yeah, y'all don't understand. They are holding it together, but they are coming home and they're unraveling. And I unfortunately have sat in meetings where the school is like, not our problem, but it is. It's all of ours to address. But this is where we really have to rely on parents, and it's uncomfortable at times, it's stressful, but it's that communication. So what is it that you think is happening at school that is sending them over the edge so that we can potentially reduce that or accommodate or whatever? So it's that good communication, because I just hate to hear that, because I do know it happens a lot, and that's very unfortunate, but it goes back to that communication. But to your specific question about transition away from accommodation, I'm going to go back to what I've said sprinkled throughout. It's about having the evidence, the data. It can't be, to your point, you know, Laura, it's a great example. Oh, 3 days. Yay, they're fixed, they're all better. That's awesome, 3 days. Now let's keep that trend going. So what is it that we're doing? And let's keep some good data, right? Because we need to have that data to help us make informed decisions. And it's so hard when it comes to mental health, because it's emotional, it's stressful, it's tough, especially if you have really extreme behaviors. But without the data, you're just throwing things in the wind. That has to be your starting point.
And can I add to that? What we want to also establish is what's the baseline before we put the accommodation in place, so we can see the effect and measure whether or not it's working. When we do behavior support plans too, one of the things we want to include right at the get-go is how do we know it's working? And so setting up a schedule to review that accommodation, how is it working? What's our criteria? What's our frequency of checking back to see if it's working? Those are important parts as we consider that transition. And Laura, you're exactly right. We were looking for fluency. We're not just looking for 3 days, but what really establishes that this child is benefiting and could move to a lesser support level.
tongue in cheek, at this point, I have about 12 years of data following that 3 perfect days that I think I could use to substantiate that we are not cured. But I wanted to quickly, I want to just kind of throw through some slides. We do need to end, but we had one other question, Charlie, that I think you could field quite nicely. What happens when the people in charge of the plan drag their feet and don't actually implement the plan, which means that the parents feel like they're always coming back and pushing, and then they feel like they're sitting in the role of the bad parent, the nagging parent. And while you're answering that, we're going to flip through some slides that show you some resources. So don't be distracted by my flipping of slides.
Yeah, a couple of things. Well, first, don't ever forget that you have not only the Idaho Parent Network, but you have iPool. You have resources from a parent to parent that you really need to utilize, because they have just a wealth of knowledge and expertise, etc. But from the State Department, if you're getting into those meetings where you just feel like, oh my gosh, I keep hitting a wall, they keep giving me lip service saying, yeah, oh yeah, we're going to do this, and then you walk out the door and nothing happens. If you're not familiar with it, we here at the State Department have a service called the IEP facilitations. And all it takes is a phone call. You can go to our website or you can fill it out online, whatever works best for you. But the facilitator is a neutral person who will come in and guide the team through the IEP process. And our data is very compelling that it works. It's a way to make sure that in good faith, everyone is participating, everyone has the ability to voice their concerns, and ultimately you are following the IEP process. Well, you're probably thinking, well, that doesn't help me. They do that well. It's the implementation they're not doing. But they can help with that. That's the issue you share with the facilitator, because they'll call you and say, well, what is it that you're really struggling with? And you can say implementation, and they'll say, great. I'm going to build that into the agenda and we're going to address that. So it can be a very, very powerful tool. And I like to tell districts, it helps them in that you have to think of it too from their perspective. Sometimes whoever is facilitating the meeting oftentimes is wearing 2 hats. Right? They're trying to run the team meeting. They're trying to make sure the process is followed, and it's too much. And take yourself out of that hot seat. Let somebody come in. They're going to focus on the process, and then you can really engage in meaningful dialogue. So request a facilitator.
So, well, I'm going to say thank you to all of you for being here today. We have another session starting in 2 minutes. And so we're going to go and we're going to log off so that we can get on to the next one. But I think this is an important conversation. If families and educators have more questions, CEST is a great resource. Obviously, iPool is a great resource. And check back with the Parent Network website. All of those resources we flash by will be available to you guys. And thanks to all the parents here. So many more suggestions we didn't have a chance to get to, but I really do appreciate all of you guys being here. Have a wonderful, wonderful day.
Thanks for inviting us. Thank you
so much. Bye.
Bye.